Good evening, everyone, and thank you for joining tonight's webinar on New Jersey's medical aid in dying for the terminally ill law, How to Access. My name is Amanda Kavanaugh, and I am the campaign manager for Compassion and Choices in New York, as well as New Jersey. I will be your moderator this evening. A few housekeeping items before we begin. If you'd like to ask a question at any time, you can put that in the Q&A box on your screen. At the end of our presentation, we will answer as many questions as we can get to. Additionally, you should know that this webinar is going to be recording and available in the future. Please note that everyone that is a participant is in view-only mode. This means both your audio and your video functions are disabled, and neither will appear in our recording. Today, you will hear from a panel of speakers, including myself, Compassion and Choices Senior End-of-Life Consultant, Gina Johnson, Deborah Dunn, who's both an RN, registered nurse, and an advocate, and Janie Rakow, founder of Farewell Doula. We appreciate them being on tonight and look forward to hearing from them in just a few moments. Compassion and Choices is the organization that brought you this webinar this evening. We are the nation's oldest, largest, and most active non-for-profit working to improve care, expand options, and empower everyone to chart their own end-of-life journey. We believe in patient-centered care, where the person is in charge of making their own healthcare decisions. Also, that people should be fully informed and supported by their doctors and medical team on a full range of end-of-life options. New Jersey's medical aid in dying for the terminally ill law passed a year and a half ago on April 12th, 2019. The law then went into effect on August 1st. Since then, Compassion and Choices has worked hard to engage in public education, conduct outreach to providers and systems. We've sought to expand access to care. We've forged new partnerships across the Garden State. We've mobilized in defense of the law. And we've, of course, had to shift quite a bit of our work due to COVID-19. We know that there are barriers to accessing the law. Compassion and Choices has been doing this work for over 20 years. And although we understand that it's not comforting to patients who are trying to find a provider, it's not surprising to Compassion and Choices where we are in New Jersey at this current moment. We are optimistic that the law passing just one short year ago is providing New Jersey the right track for end-of-life options for all of their residents. This time period of early adjustment is not unique to the Garden State, and the willingness of the Department of Health and other large healthcare systems to talk with Compassion and Choices and adopt policies leaves us confident for the future of access to this care. Later in the call, I'll share more about the work that we've done and how you can help expand awareness and education for medical aid in dying. New Jersey is one of 10 states that have a medical aid in dying law as of 2020. But as you can see by looking at this map, that there are a number of states who introduced legislation, over 20 in 2020, and we look forward to the movement continuing. So what do we mean when we're talking about medical aid in dying? Medical aid in dying is one of many end-of-life options. It's a medical practice in which a terminally ill, mentally capable adult with a prognosis of 6 months or less left to live may receive medication which they can choose to self-administer to bring about a peaceful death. Medical aid in dying is not a practice that causes more people to die. It is a practice that allows fewer people to suffer. There are a number of provisions to a law like the one in New Jersey's. The law specifically states that a death resulting from self-administering aid in dying medication is not assisted suicide, nor is it considered suicide. To a terminally ill person, the term assisted suicide is offensive and hurtful because it suggests that the person no longer wishes to live. People who pursue medical aid in dying want to live, but their disease is killing them. Doctors must list the underlying disease as the cause of death on the death certificate should a person use medical aid in dying. The law also provides additional protections. Accessing medical aid in dying does not adversely affect a person's will or insurance. The law specifically mandates that wills, insurance, contracts, and annuities are not affected if a qualified individual shortens their dying process and suffering by ingesting medication. So we've talked about what the law is, but why do we need a medical aid in dying law? At this point, I'd like to turn it over to registered nurse and longtime volunteer and advocate Deborah Dunn to explain why this is so important.
Thank you, Amanda. So just briefly, I became involved with legislation and getting the bill passed into a law about 6.5 years ago. My husband had pancreatic cancer. He was also a nurse, and he developed pancreatic cancer. And so he did chemo. He was home. He went on hospice. Everything had to end. And I watched him, and he watched himself go through traumatic deterioration of his neurological system and every other, system of the body. I know that if this had been a law, and had we known about it and it was a law back then, I know without a doubt my husband would have availed himself of the law. So when he died, I decided that the way he died, even though he was in hospice, morphine wasn't helping him at all. I decided something had to be done, that this is not how I want to die. This is not how he wants to die. And there must be other ways. And I fell upon Compassion and Choices. And I went to Trenton with them on a regular basis. I took off from work all the time and spoke to legislators about why this law needed to be, or this bill needed to be a law. So watching somebody become very ill is why we need medical aid in dying as a law. It is one option of many, and many people are not interested in it, and that's fine. But for those who are, there's no reason that they should not have something like this to be available for them to have. So I'm very pleased and proud and glad, and continue to work as a volunteer with Compassionate Choices, because there's much work to be done still. We've kicked off the ball and we're going forward. Thank you. The other piece of this is about the prescription. Sometimes, if you really think about people and what they want in their lives, they just want a sense of control. My husband lost his sense of control. And that's really the end of life, when you feel like you have no control over anything. And so sometimes just having a prescription means so much to the person, provides such comfort to them, that that's enough. They don't fill it, they don't take it. Or sometimes they'll fill it, but not take it. So that comfort is so, so, so critical for somebody to breathe out and sigh and with relief, saying, I'm just glad we have it. One of the advocates that was going to Trenton all the time is terminally ill. And she and I talked a lot. She had a rare lung disease. And when this became law, the first words out of her mouth were that she's just relieved. It was a sigh of relief that now she knows that if she wants to do something along this line, it exists. That comfort, there's nothing that can replace that.
Thank you so much for sharing, Debbie, and for all you do for Compassionate Choices, as always. I'd now like to turn it over to Gina Johnson, our Senior End-of-Life Care Consultant at Compassionate Choices. Gina's going to tell us a little bit more about the relief that patients find by just having a prescription, and then also go into details about what other end-of-life options outside of medical aid in dying that people often talk about. Gina? Hold on, we gotta unmute you.
Okay, am I here now? Okay, So I was going to say the majority of phone calls that we get at Compassion and Choices from people who are looking simply for what their options are for end of life, regardless if they're sick or dying, they just want to know what's out there in the world of options. So one of the things I tell people, if you're in an authorized state that has passed legislation or a voter initiative for medical aid in dying, you may be eligible for that. You can also, if you end up not being in a state or in a chronic condition, say in New Jersey, you can opt for an option that's your legal right to stop any unwanted medical treatment. There's another option. You can stop any unwanted nutrition or hydration. So I guess what you can do too is just discuss, have a really earnest conversation with your medical provider, with your family about what your end goal is. Is it just about knowing you have control? Maybe it's just knowing you have options that you could exercise anyway. But like Deborah said, you know, sometimes it's good to go through the hoops of finding a doctor, getting medical aid in dying, having the prescription written out so that you know you have it should you decide to take it. And like Deborah was saying, it's extremely important to most people to know that they have a way out. Most people say, I'm not afraid of dying, I'm afraid of suffering. And so what they want to do is just have that option in case the suffering becomes too much for them. And you can fill in the blank of what kind of suffering, but usually it's the physical. And people are happy to just have it on hand, you know. So I'm seeing on the list here, I just want to cover a couple more things. If a person is in pain and it can't be managed well enough while you're awake, like they throw all the pain meds at you and you're still in pain, what they'll then do, usually hospice, if it offers this option, will say, listen, as the last resort, we might be able to get a handle on your pain if we gave you enough medication to put you into a medical coma. And that way it would guarantee that you were not suffering. However, the upshot of it could be to hasten your death. And a lot of patients, if they're at that point with hospice and pain management and symptom control, they say, okay, let's give this a go. We've tried everything we can, and my choice to not suffer anymore is mine to make. So again, not all hospices offer it, but it's a good conversation to have with any caregiver that you work with. And then of course, medical aid in dying. Do you want me to elaborate on medical aid in dying? I guess, no? Who's going to do this one?
You can do this one.
Okay, all right. So what I tell people too, when they're looking for what they can do to talk to their doctor or be prepared in their conversation with a doctor, is they just find out, you know, what can I do or what are the parameters of that. So in New Jersey, as in most other states that have authorized medical aid in dying, you have to be an adult, terminally ill, with 6 months or less prognosis. You have to be mentally capable of making and sustaining this choice. Also, you have to be a resident, of course, and that you are able to take the medication on your own, to self-administer the medication. And so those are the things that we make it very plain to people who call. Compassionate Choices is not the gatekeeper to the law, but what we try to do is educate and empower people so that they're ready to have that conversation with their medical provider.
Great, thanks, Gina.
Mm-hmm.
So what are the steps? We know what it takes in order to be able to be eligible for medical aid in dying. We know that it's a law. We know that if you're terminally ill, you might want to access it, and you know what it is, but how? What are the steps to accessing medical aid in dying? And Compassionate Choices has really put together some wonderful resources that I'll share with you later, a tracking document that goes through these steps and all of these great things to guide you through the process. But I just want to take some time this evening to do that with you all. So imagine you're a terminally ill patient who wants the option of medical aid in dying. For some people on this call, that might not be hard. The first thing that we always want you to do, whether you are in an authorized state or not, if you think that medical aid in dying is something that's important to you, you should talk to your doctor. It sounds like a no-brainer to have this conversation, but people are often surprised whether the conversation is very positive or whether you learn that your doctor might not have the same values about end-of-life care that you do. So it's very important that you're clear with your doctor about what it is you're asking for, and that you might be interested in this. But the actual nitty-gritty steps, aside from just saying you're going to talk to your doctor, in New Jersey, the first thing you have to do is make 2 verbal requests for a prescription for aid in dying medication directly to your doctor. And those 2 requests have to be separated by at least 15 calendar days. So if you receive a prognosis that you have 6 months or less left to live, you may want to think about when you would like to make that request, because you have to do 2 verbal requests 15 calendar days apart. In addition to your prescribing physician, a consulting physician must certify that you are eligible to use the law and that you're making both an informed decision and a voluntary request. So that's a lot of big words, but basically what it means is that not just the physician who would be prescribing the medical aid in dying, a second physician has to say that you are terminally ill, and that you are making a decision of your own free will, and that you know you have a clear understanding of the decision that you're making. The third step would be if either of the physicians felt that you were making this decision under duress, depression, not of your own free will, then they would have a psychiatrist, psychologist, or licensed clinical social worker do an evaluation to make clear that you are understanding the choice that you're making and that you do have the mental capacity to make that decision. Just because a physician says that you need to have this sort of evaluation does not mean that the process stops. It just means that they want this third opinion from a social worker or psychiatrist that this is the right decision for you. However, if this social worker were to say that you didn't have the mental capacity or that maybe you shouldn't be making this decision, then the process would in fact stop. So this is just one step that some patients have to go through if they may or may not be in the right stages of mind at that time. The next step is that you must fill out the request for medication to end my life in a humane and dignified manner form and give that form directly to your intended attending physician. This form has to be witnessed by 2 people. So you fill out this very form that is clear about what it is that you're asking for. You have 2 people witness it so that they know, the physician knows that you're having conversations with people and that, you know, this is something that you'd like to do. For people who might be hurry up and jotting down all these slides of information, again, I just want to remind you, Compassionate Choices has all of this information in a guide on our website. So I'm going over them and talking about them. I'll certainly answer questions at the end, but don't feel as though you need to jot all of this down. We have plenty of information available and resources for you. So the next step is at least 48 hours after the request of that form is signed and dating, your prescribing physician may write the prescription. So again, to be clear, you have to wait, you have to sign, you have to sign this form, and then 48 hours after that, the doctor can write the prescription. So if you sign the form and you want the prescription that day or the next day, that's not how the process works. You need, there's a 48-hour waiting period. The prescription will be sent directly to the pharmacy by the prescribing physician. And the pharmacy may need some time to order the medication and get that in stock for you. So again, I'll reiterate that if this is the process that you're thinking about or that you may want to have, it's the sooner you start the conversation, the better you are. Because the minimum amount of time the process can take from the first request to the written prescription is 15 days. So that can be a lot of time when someone's facing a terminal diagnosis. My apologies. You don't have to pay for the medication until the prescription is filled. That's often a question, and it is up to you when you take the prescription. So just because you get the prescription, filled, doesn't mean that you have a certain amount of days or time to take it. That part is up to you. So again, why we say it's better to start the process sooner and then have it and either take it or never take it. Some patients don't, but the sooner that you go through the process, the better. It's important to know that you can withdraw your request at any time, and there is no obligation to take the aid in dying medication simply because you have it in your possession, because you made your first request. Patients can always change their mind. If a person does pick up the medication, then they are required to designate the person who will be responsible for its safe disposal if they ultimately don't use it. So you should have, someone that you trust that's trustworthy so that you can ensure that it has a safe disposal if you do intend not to take it. Talking with your doctor, I promised we would come back to this, and it's just so important. Some people feel anxious about discussing medical aid in dying with their physicians, but by explaining your preferences early in your illness or your diagnosis, you're more likely to have an end-of-life care experience that's consistent with your beliefs and values. If you don't have a terminal illness, but you want to know where your doctor stands on medical aid in dying, you could always say something like, I value quality of life. If I'm no longer able to find dignity in my life and I meet the legal requirements, I would like to have the option to use medical aid in dying. I hope you'd honor my decisions and respect my values as I respect yours. Would you be willing to write a prescription for aid in dying medication in accordance with the law should I become eligible? If you wouldn't honor my request, please tell me now. Having that conversation is so valuable and so important. I'm the campaign manager for Compassionate Choices in both New York and New Jersey. I had this conversation with my New York physician, and it put me at great ease. I'm not ill in any way, but I know that if I were to become sick at any point, my physician holds the same values that I do, and you can't underestimate that importance. If you are someone who does have a terminal illness, then the conversation might go a little differently. You could say, I want the option to advance the time of my death if my suffering becomes unbearable. Am I eligible or not? If I am eligible, would you be willing to write a prescription? So these are great tips on how to talk to your doctor, but what if your doctor says no? We know that happens, especially in a state like New Jersey where the law is brand new. So, is your doctor allowed to prescribe? You may think that you're seeing a physician, but are they a physician's assistant or a nurse practitioner? They might not be someone that can prescribe the law, so they can help you find a prescribing physician who could. Are you the first patient that's requesting medical aid in dying through your doctor? Some doctors are uneasy. This is brand new in New Jersey. Compassionate Choices offers doc-to-doc consultation service, meaning that a brand new physician could call a seasoned physician at Compassionate Choices and talk through what the process is and what that looks like and usher them through the process. If your doctor is absolutely not going to prescribe, this is not something in their values, you can ask them to refer you to a doctor who will support you. If they don't want to refer you to someone or they don't know of someone, you can visit our Plan Your Care Resource Center at compassionandchoices.org. We have a Find Your Care tool where you'll be able to put in your zip code and find medical groups that list out what their policies are, whether they're in favor or supportive. A lot of them are neutral, but you're able to find care on that tool. The other option is always using the Academy of Medical Aid in Dying. That is an organization out of California, but provides services across the country. And they can also help you locate a physician and refer to one. So now we've gone through all of the steps and what it takes. But who should be there with you, and what other services can be available as a patient is going through this option? I'd like to turn it over to Janie to talk about end-of-life doulas and the help that they can provide.
Thanks, Amanda. So I'm an end-of-life doula. I've been an end-of-life doula for probably the past 15 years. And end-of-life doula is trained specifically about death and dying. And they companion the patients through the end-of-life process. We can get involved as early as diagnosis, and we're basically there with the patient and the family through death and sometimes even after death. Since the process is patient-led and performed outside of a healthcare setting, strong support is needed. Many hospices and healthcare facilities will not be involved on the day of death. To me, this was eye-opening. In New Jersey, since MAID is so new, I had really no idea when I got involved in this whether hospices would support the patient or not. And I quickly found out that it varies. And it is pretty much like the Wild West right now in New Jersey because it's so new. And I know that will be changing, but I had a patient about a month and a half ago, and she needed to be on hospice. She had the medication, she had a date set, and I spent a day and a half talking to different hospices, trying to find out whether they would take her on their service. And I got all different answers. Some said, absolutely not. Some said, I'm not sure, can I get back to you in a couple days? We don't really know what our policy is yet. Some do have policies, like I know Atlantic Health System was on board really early on, and they do have a policy, but they weren't within our jurisdiction for her to be on it. So it's really a little bit all over the place. So I know things will change, but right now you really have to find out which hospices are on board. So Amanda, we'll go back 2 slides. I think you're still muted. But perfect. So relieving caregiver stress and burden by orchestrating and taking control of the specifics of medication and education about the process. People are very stressed when their loved one is dying. The anxiety level is really through the roof on an ordinary day. And couple that with trying to understand the meds and mix the meds, it's really much easier to have a companion, someone else there who can do that and relieve the loved ones of the stress. Let them go and be with their husband or their wife, and let someone else, a doula or another person, mix the meds and really go through that process. The doulas also bring a calm presence on the day of planned death. You know, this is what we do. We understand the dying process, and so calming everybody down and normalizing everything is part of what a doula does. The ability to talk openly and honestly about your end-of-life choices without judgment. Sometimes families are really conflicted about their loved one taking this medication, and the doulas can be there for the person to talk to them honestly, openly, how they feel. And we can talk to everybody else how they feel also. But just to have open and honest conversations with no judgment about what they are doing is so helpful. Also, we can advocate for hospice, because in New Jersey right now, if someone is not on hospice and they die, you must call 911. And we had this with our patient recently. She wasn't on hospice. And so we asked her, you know, she was terminal, she had 6 months or less. Why are you not on hospice services? Because they can offer so much. And she said, I don't need hospice. It's really not necessary. I've got everything under control. And what we explained to her was that when you take your last breath, if you're not on hospice, we need to call 911. She was in a townhouse community. No one around her, her neighbors didn't know what was going on. And I said to her, if we call 911, the police could come, the EMTs are going to come, the sirens are going to go off. And she was shocked. And she said, I don't want my husband to go through that. No, 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 no. And I said, that's why we really need to get you on hospice. Because if you die on hospice, then the nurse is called. And then the nurse comes out and pronounces the death. And then we seamlessly can go on to the funeral home. So sometimes being educated about that is really important. Doulas can review the necessary documentation if they have a pulse, advance directive, funeral arrangements. When somebody is going through MAID, they know when they're going to die. You know, this is very different than a lot of end-of-life scenarios. And so we can talk about the funeral arrangements freely. That can be, you know, done. We want to see any advance directives, any pulse, any other documentation. Talking to the loved ones about what to expect and how to provide compassionate support, and educating about the dying process. I would venture to guess that most of us in our normal course of life don't really see many people taking their last breath, which is, you know, great in some ways. We've prolonged life, but it also makes it much scarier for people when they're witnessing the dying process. They don't necessarily understand what's happening. The body is breaking down. The body knows how to die. And so watching the apnea, the breathing, the fast breathing, the slow breathing, sometimes the gurgling sounds, sometimes something called modeling, where you can get this very spidery look on the face or on the hands or on the legs. It really can be scary for people who've never gone through this. So we want to just normalize and explain what is happening so that people are much calmer and they understand that this is the dying process. Creating legacies. Legacies are mementos that live on long after the loved one has died. So we have helped people write letters. We were with a woman who, her daughter was pregnant and she was having a daughter. So the grandmother was dying and knew that she would never get to see her grandchild. And so we wrote letters to this unborn grandchild from the grandmother, just telling her how much she loved her, even though she never met her, and her wishes and dreams for her life. That's a legacy. Doing simple rituals to honor someone's life. We can suggest just lighting a candle, maybe saying a prayer, maybe people forming a circle around the person who is going to be dying and just saying something meaningful to them. That's a ritual. We talk about the grief process. With a MAID patient, grief starts well before the person has taken their last breath because it is a conscious effort, what they are doing. And so people start grieving, loved ones start grieving well before that last breath. So we want to talk to them about the grief process. will attend the death and stay until the funeral home comes. So we will take that burden also away from loved ones. We recently had a death where the husband decided after she took her last breath, he went into the bedroom, he closed the door, and he didn't really want to see her being taken out. So my colleague and I stayed and just made that happen seamlessly. And following up weeks after the death, talking and reprocessing the death and loss. When you're there, when somebody takes their last breath, it's such an intimate moment. And the people that you are there with really get very attached in some ways to you. And so it's really an honor for us to go back and talk about that death and reprocess that with them and talk about what happened and what they had witnessed. So these are just some of the things that the doulas can do with MAID clients.
Thank you so much, Janie. I appreciate that. There's, and we'll share contact information afterwards, but certainly you can see why having an end-of-life doula would be a consideration for someone going through the process of medical aid in dying or end-of-life care in general. It can certainly be a helpful tool. Not necessary, you don't have to, but it's certainly a value add if it's something that you're able to have. So we just want to take a few moments to review a little bit about what we've talked about thus far. As I mentioned, Compassion and Choices has a lot of tools on our website, and you can see them up here. But our medical aid in dying tracking sheet, I know I went over all of those steps with you, and it could almost seem burdensome, but Compassion and Choices has created this great tracking sheet that lists out all those steps for you, and you can keep track yourself and have all of your notes written down as to when you've made your requests and what you've been doing so that you can stay on track with the process. You can find all of these resources and plenty more if you go onto our website and go under our end of life planning area. There's so many things. Additionally, if you go under our New Jersey webpage, we have a booklet called Introduction to Medical Aid in Dying. And it goes through all of the steps in great detail, as I did on this call. It includes the tracking sheet and many other things. So I would certainly suggest that you do that. However, outside of medical aid in dying, or even if you are considering medical aid in dying, there's a handful of things that we suggest you consider. Gina, would you like to talk about those?
Okay, here I am. So one of the things that we do get a lot of phone calls about, as well as end-of-life options, is what's an advance directive? And that is something that we need, everybody should have at the very minimum, to be able to, it's two parts. An advance directive is two parts. One is a living will in which you declare what your medical wishes would be in case you become incapacitated. And the second part is designating a trusted person to advocate for those wishes while you're incapacitated. So that's always good to have. We coach people through, what is it you want, basically on your value system. What is it? Is it quality over quantity? Do you want to wait till graduation of the great-grandkids, or, whatever it is that you're aiming for? And give a copy to your healthcare proxy, give a copy to the doctor for your medical records, make sure you have it handy. So that's one thing that we really do emphasize with people, to make very clear what your medical wishes are to your loved ones and to your medical providers. Again, identifying and assigning a healthcare proxy can be a little tricky because there's no entity out there that poses as an organization that would be that for a person. The sad fact is there are a lot of people who call who are single or widowed or divorced and live alone, and they're isolated, and they don't have people who they feel they can trust to make these big decisions on their behalf. So that's always a very tricky thing to try to suss out for each individual. So that's something to always keep in mind when you're talking to friends and family. who seems the most open and most inquisitive about those things that are a concern to you, and maybe you could consider them. A post, which goes by other names in other states, but a post stands for POLST. It stands for practitioner or physician order for life-sustaining treatment. And basically that's a document that is filled out by your doctor and signed. It's usually printed on neon bright colored paper and posted in a conspicuous place in your home, like on the inside of your front door or on your refrigerator, someplace where if EMTs are called to your aid, they're trained to look for those kinds of things. And what it is a doctor directive, as if the doctor's standing there telling the EMTs what to do and what not to do for you. Usually a post form, when you get it from your doctor, it's because you're either terminally ill and not expected to live maybe the next year out, or that you're in such a frail state that you're not expected to benefit from any medical interventions. And so definitely, just like everything else we're talking about, it requires conversation with those people that are help take care of you. Last will and testament and living trust is something that we don't work with here in end-of-life consultation. That's more legal stuff, so you would have to find legal professionals in order to address those things. Life insurance policy is the same. Usually the question we get is, would my insurance policy cover my death if I take this medication for medical aid and dying? Yes, it's written in the law that it is, your death is attributed to your illness and not the medication. But that's about as far as I can go because, again, that's out of my wheelhouse when it comes to insurance policies. Memorial services and funeral arrangements, when people talk to us about that, it's more about getting clarity about what they want to do or can do. And we, again, redirect it back to the person and say, what are your values? What are the things that you would like to have done as a final goodbye to the world? And it can be, you know, some people have like videotapes of themselves when they were healthier, talking to friends and family. It can be a friend who is a really good piano player. So you ask them to be at the service to play the music. You can say flowers or no flowers, or please send donations to my favorite charity. When it comes to instructions regarding finances, again, that's up to the person, but we can help them with some, you know, problem solving and just practices to consider. We never direct people about what to do with things like that, but we do say, make sure whoever you're working with is a trusted person or persons that can be accountable to your family once you're gone. So that's about it for the finances.
Thank you so much, Gina. As you said when you were speaking, it's all about having conversations and being clear about what it is you want and what you would like done with your things. And so the more detailed instructions that you can leave, the better off you are. And actually your family will be very thankful that you went through and you did those things.
Yeah, for family members, it can be a relief, yeah.
So we've talked a lot about what the law is, what it does, how to access it, but how can you ensure that people can actually use medical aid in dying? As we said, we understand New Jersey is in its infancy stage, and we still have a lot of work to do. Just because the law passed doesn't mean that it's done. So again, talk to your doctor. Tell them that medical aid in dying is important for you, and ask if they support those decisions. Volunteer with us at Compassion and Choices. We're always trying to give presentations and make inroads with new providers so that people can become educated. Awareness is huge. Connect us with groups and organizations that would like a presentation like this or would like to have a conversation about the ins and outs of the law. And same thing with medical professionals. We cannot ensure that everyone has access and that it's a viable option for everyone without having conversations and really getting in front of doctors. So we can always use more help in New Jersey, regardless if the law is there or not, to keep expanding this and having conversations. Another great way to help is to share your story. They matter. We passed this law in New Jersey because stories matter. They help convince others, and they can certainly influence legislators. We're not at a place right now, thankfully, where we need to do any convincing of legislators, but doctors, medical professionals, healthcare organizations, they all need to understand why this choice is so important. As you can see on the right-hand side of the screen for me, maybe left-hand side for you, I'm not sure. But there's an article that Dr. Jessica Israel wrote in New Jersey, and she shared about the first time that she helped one of her patients access and utilize medical aid in dying. And it brought her such unexpected joy to be able to help this patient and give them their final wish. And so that story appeared in New Jersey, and it helped influence other New Jersey physicians to be more comfortable. It helped nurses become more comfortable. But the influence it also had across the country, because we were able to say to New York lawmakers, look, here's a New Jersey physician who says it's not that bad, and how great it was that she was able to do this for her patient. So stories not just in New Jersey help New Jerseyans, but they're helping across the country to show the experience and how profound it really is. As I've mentioned a few times, Compassion and Choices has so many free resources and tools. At our website, compassionandchoices.org, you can find information, resources, tools specific to your state or just national or in general. I would be remiss if I didn't talk a little bit about to tell you that we have a dementia values tool, values and tools. Information. We have a whole area on dementia. Sorry, I'm jumbling my words a little bit. But there are just, there are a number of things. We as an organization are working to make end-of-life care better. And that doesn't just mean because people are accessing medical aid and dying. It means helping with dementia and Alzheimer's. It means getting patients the information they need when they receive a diagnosis and helping them figure out the questions to ask. As Gina is on the call today as our senior end-of-life care consultant, those counselors and that service provides confidential, non-judgmental professional support and information on the full range of options about end-of-life planning anywhere in the country. And you can always reach them. There's a toll-free number that'll be up later. You press 1, you leave a message, and someone gives you a call back within a couple of days. But we provide, there's so many great things on our website to check out, and certainly Gina would be happy to help people. We have resources available in not just English, but also in Spanish and Chinese. We understand the growing population in our country, and we want to make sure to offer resources to anyone and everyone. So certainly don't feel like we don't have those for you. Of course, given the current state that we're in, we provide a COVID-19 toolkit on our website now. We have done a number of presentations on who's affected most by the coronavirus, what that means if you have a terminal illness, et cetera, et cetera. But we also have information about what to look for if you are a person who's elderly and you got a COVID diagnosis. There's real things to think about and look at. Would you want to be placed on a ventilator? Would you want CPR or any life-saving treatment? So aside from medical aid and dying, we really sprung into action and did a lot of work around COVID-19 and what people should be thinking about. So I encourage you to take a look at those resources on our website as well. As I said before, you can always sign up for a Compassion and Choices talk like the one that we're doing this evening. We can talk about a variety of things. We can talk about dementia. We can talk about our diagnosis decoder. We can talk about just advanced care directives, or we could talk about medical aid and dying and the law as it stands. So certainly, if you are part of an organization or you are interested in having a conversation or a presentation, certainly let us know, and we will be happy to work with you on that. And we have a newly formed organization that's happening right in New Jersey on the ground. So I'd like to turn it over to Debbie to talk a little bit about that.
Thank you. Yes, so a physician in New Jersey and I and a colleague of hers at the hospital system she works at are forming a new organization called End of Life Care New Jersey. We are brand new, literally, which means that we do not have a website yet. We've had 2 meetings. We're having our 3rd meeting tomorrow, and we want to provide resources. So we're looking to talk to physicians and grow that list. We're looking to talk to hospice nurses and grow that list. We're looking for any kind of healthcare provider and grow that list, whether it be social workers or doulas or any other healthcare providers. We're also looking for volunteers, but our needs are great, but we just started. So there'll be a lot more to come, but we're only doing this 1 year now with the law. So getting this off the ground will take us probably about 9 months to a year, but that's pretty quick. So we're really pleased and proud to form this for you. And our goal is to make you aware and have resources with which to carry out the end of life care that you want. The most important thing that this site is going to offer, as far as I'm concerned, is education. If you don't have knowledge, you have fear. With education, you understand and you can take a deep breath and say, okay, I understand that. I knew that was going to happen. So education is going to be a huge impetus for us. But you'll hear more about this in the future. It'll be called End of Life Care New Jersey.
Great. Thanks so much, Debbie. And Compassionate Choices looks forward to continuing to work with you all and supporting this organization in any way that we can. Thank you for joining tonight. If you are a medical provider, a nurse, a doctor, a physician's assistant, an aide, we are going to be hosting an event next week, Wednesday, November 18th, again at 7 p.m., on how to practice under New Jersey's medical aid in dying law. Our goal here is really to take people into the fold with a doctor from New Jersey and also Compassionate Choices Medical Director, Dr. David Grube, about how this law works, the intricacy parts, the down and dirty that the physicians have to deal with on the back end. So we know it's just as important for doctors and nurses to work hand in hand and know what this process is like. So we hope that some healthcare professionals will join us next week for that event. You can always find us and follow us on social media. We're on Twitter, Facebook, YouTube, Instagram. If you liked this event tonight, I strongly encourage you to take a look at our YouTube. We have a lot of great webinars that we've been doing since the beginning of COVID that you can look through. As promised, you can find all of our contact information on here. I would say the easiest thing, if you want to remember anything tonight, is our nj@compassionatechoices.org email address. That's something I personally check daily, and I can put you in touch with, obviously, myself, but with Gina, our end-of-life care consultant, with Janie, who is a death doula, with Debbie about her new organization. So if anyone would like information, certainly feel free to use these tools. But if you're having trouble, just remember nj@compassionatechoices.org, and I can help you get to any one of us on the call this evening. We are going to turn to questions at this time. However, before I do that, I know Dr. Plumer, who is a physician in New Jersey, is on the call this evening. And I promised that I would give her a moment to address all of you. So bear with me just a moment as I get her on. Dr. Plumer, you should be able to speak.
Okay, hello, can you hear me?
We can. Go right ahead.
There you go. Amanda, I know that you mentioned earlier the ACA MAID organization. I just wanted to highlight that website. It's www.acamaid.org. That is a national organization where people could submit a question, particularly if they're looking for a doctor in any state. And in the states where MAID is legal, then the people at that organization will try to match them up with a doctor. So that's, I think, a really important resource. I do have a practice in New Jersey. My practice is called CompassionateEndingsNJ.com. And myself and my partner have a background in emergency medicine as well as in hospice. And we work as a two-person team a little bit differently than some of the other doctors because we are completely devoted to medical aid in dying and end-of-life care. And we make it a point to attend the deaths of our patients as well to try to help the families and make sure there are no problems. So I appreciate you letting me say that. Thank you.
Absolutely glad to have you, and thank you for helping the patients of New Jersey. So now I'll turn it over to questions. Corinne Carey is going to be moderating for us this evening. Corinne, do we have any questions?
Yes, Amanda, thank you. We've got someone asking if a patient and their family experience something inappropriate, like a hospice threatening to discharge you if you express your desire for medical aid in dying, what would you suggest that they do?
I would suggest that they immediately contact us, whether you contact our end-of-life consultation service line, our 800 number, and you speak with Gina or one of our other counselors, or you reach out to the campaign itself, myself or Corinne at the NJ email address. We can help you. We have contacts at the Department of Health, and we can assist if something like that were to happen. So don't suffer in silence. Don't try to figure it out on your own. Reach out to Compassion and Choices, and we will do the best we can to assist you with something like that.
Definitely.
Great. Another question is coming in from someone who's saying that they have a loved one who lives in a neighboring state. Is that person able to access medical aid in dying if they move in with their relative who lives in New Jersey?
Gina, do you want to take that one?
Yeah, that's another big one that we get a lot. Well, technically, sure. If they move to New Jersey, yeah, but remember, the person has to be able, not that the doctor would demand it, but if the doctor did demand evidence that the person is a resident, they have to present proof, like a driver's license, a voter registration card, something like that. The other thing is if that person is moving into New Jersey from another state, which means they're leaving their medical providers in their original state, now they have to start fresh with brand new doctors who don't know them. And that can be a challenge to get people up and running on your case, your history, and what you're looking for. But people do that. I mean, Brittany Menard was the one that, we thought, this is what we were telling people, don't do this. And Brittany did without, we didn't even know who she was at the time, but she did. But she got all her ducks in a row and she found her own doctors and all that kind of stuff. So yes, technically it's possible. It's simpler in concept sometimes than it is in execution, I guess I'll say.
Two more questions, Amanda. Someone is asking whether any of the process for medical aid in dying can be handled via telemedicine during the coronavirus pandemic.
Oh, this is a favorite question. Corinne, I almost want to turn it back to you, but no. Yes, some of the process can be handled via telemedicine at this time because of the pandemic. However, there's no guarantee right now in the legislature that once the pandemic is over, that you would still be able to go through any of this process. Obviously, a doctor needs to know the patient, needs to have conversations and feel comfortable prescribing. So I think it all goes back to that part where we talk about conversations and your relationship with your doctor and education. So Corinne, do you want to add anything to that? I mean, the answer is yes, you can go through the medical aid in dying process right now via telemedicine. However, we don't know once the pandemic ends if those rules will still apply. And also, it is often up to what the physician is comfortable with.
Yeah, I think that's a great answer, Amanda. The only thing I would add is, and this is true of just about any question that folks might have, is that if you run into problems or if the law creates such great barriers to care that you find it impossible or hard to access, share that story with us, because the only way that we can affect change in New Jersey is by knowing what those barriers are. So if, if your physician is saying that they can't do things by telemedicine, or if those rules come to an end and we have to go back to everything being in person and that provides an insurmountable barrier to you, let us know so that we can let lawmakers and policymakers in New Jersey know. So Amanda, that was a great answer. The last question that we have here so far is, can Dr. Plumer give us the 2 websites that she mentioned once again?
Sure, but bear with me just a second so I can make sure that she gets unmuted. Oh, you can tell us, Dr. Plumer, if you're still here.
I'm here. Can you hear me?
We can, perfect.
Okay. I don't know if there's a place you can type it in for people to see.
I will do that, yep.
Okay, so the first one is www.acamade.org, not .com. That has a patient to physician portal. And my practice is all one word, compassionateendings.nj.com. And I'd be happy to answer questions for people if they have, even if they don't necessarily want to come to my practice, but have general questions on MAID.
Thank you so much for that, Dr. Plumer.
You're welcome.
Okay, so I would like to end this evening. 8:02, we got through a lot of information in just 62 minutes. So thank you for hanging with us until the end this evening. I'm so thankful to Janie and Debbie and Gina for being with us tonight and providing this information. And I hope you all found it useful as well. Compassionate Choices, as most know, is funded almost exclusively by individual donors like those of you who attended this evening. So with sufficient resources, we can realize end-of-life choices in not just New Jersey, but in every state. Every donation of any amount really makes a difference. So I would appreciate if you consider making a donation today. It's super easy. Anywhere you go on our website, you'll see a donate button, so that we can keep doing this work, keep expanding options across the country, and ensure that New Jersey has this option, not just in law and defending it legally, but also that everyone has access to it as well. Your donations really do make a difference. So thank you all. I hope you have a great evening and be on the lookout for the recording of this event.